si le puedo correr un poquito más para atrás. Perfecto. ¿Cómo se siente? ¿Nervioso?
No.
¿Contento?
Sí, pues.
Ya con el corte de cabello ya le dio más confianza, ¿no?
Sí, no, me siento bien, pues.
Qué bueno. Cuéntame un poco de usted, de cuándo fue cuando empezó a hacer el trasplante. ¿Hace cuánto se lo hizo?
Hace como, creo que ya hace como unos... porque me hice uno aquí como para el lado de... Aquí en Greensboro. Me hice uno.
Ajá.
Me hicieron una vez, allá en la clínica donde le dije. Un doctor allá que trabajaba una señora colombiana ahí.
Ajá, sí.
Ya.
Ahí se lo hizo. ¿Hace cuándo? ¿Hace cuánto?
Hace como, más o menos como 10 años.
Ah, ok. Yo trabajé ahí con ellos.
Ajá, sí, usted me contó.
Ajá.
Y en los otros, dos veces me lo hicieron acá en Raleigh, en Bosley.
Ajá, sí.
Pero no me gustaba
¿Se lo
porque
hizo 3 veces?
3 veces, ajá.
Wow, 3 trasplantes capilar.
Sí. La primera vez que me lo hice aquí con el doctor fue que me hizo aquí la cicatriz esta. La otra me lo volvieron a hacer, ya la tercera vez ya no me la hicieron.
Fue pelo por pelo.
Ajá, sí.
Sí, porque tiene bastante pelo. El que te hizo la línea frontal te quedó súper bien.
Sí, es el Raleigh.
¿Qué tal el dolor?
No.
¿No duele?
No.
Qué bueno. Eso que no le pusimos anestesia, eso estamos bien.
Sí.
Estamos bien.
Allá sí, bueno, allá en Raleigh, donde me dolió fue aquí, cuando estuve aquí. Y se me quiso medio hinchar aquí.
Sí, porque te hicieron una cicatriz de oreja a oreja.
Sí. Aquí fue donde me lo hicieron la primera vez.
Ajá.
El Raleigh, cuando me hice el segundo, también ahí mismo me volvieron a... Y en la tercera vez ya no.
Me imagino que la segunda vez allá en Raleigh, lo que te hicieron fue mejorarte la cicatriz al abrírtela de nuevo.
Sí, yo creo.
Porque se te ve delgadita.
Ahí mismo me la hizo, me la buscó bien la doctora que me la hizo. Me la buscó bien, ahí mismo me la hizo. Hace poco me llegó una carta ahí siempre me mandan de bola, ¿va?
¿Sí?
Y me dijeron que si quería hacerme esto.
La micro.
Entonces yo no le contesté nada. Y ahí me volvió a mandar otra carta.
Ajá.
Que mandándome a invitar que fuera, ahí me le iban a ver, pero no, ya.
Y
Ya,
cobran doble allá.
no, ya no, parece que ya lo había visto. Usted parece, hace poquito me llegó una. No, yo ya no voy allá.
Joyce, do you want to help me with the light? Yeah.
Hello, this is Scalp Micropigmentation. We are Scalp Micropro. We are a clinic here out of Greensboro, North Carolina. This is a procedure that you see to be able to cover up some balding and create more density. That's what this is. Yes, that's correct. It's a type of tattoo. It's kind of like permanent makeup, around the same category. Hello, hello. Thank you. Yeah. The person that's doing the tattooing right now, the SMP, is Victor. He's a great connoisseur of everything hair loss. Here he's working on a patient or a client that he's had a hair transplant done, and these were the final results of the hair transplant. So now he's using SMP to help conceal some of that, create some density there. Typically for scalp micropigmentation, we like to do it in 3 sessions. So they have to come in 3 separate times, about a week to 2 weeks in between, to help it heal between sessions. And each session lasts about 3 to 4 hours on average to do the full scalp. Is this a tattoo? Technically, yes, it's applied like a tattoo, but it's not the traditional tattoo that we're used to. Um, this is works on the upper layer of the skin, not deep, like body tattoos. So it heals differently and it looks differently. Yes, we do. We do scalp micropigmentation on women as well. Um, Thinning hair, traction alopecia is very common too. So scalp micropigmentation helps with that as well. And does hair grow back with this treatment? It does not. This is simply to cover up hair loss. It's for people that cannot grow their hair back. We've been operating for about 10 years here in North Carolina. Victor has a lot of experience. He also has an academy. He teaches other people how to do this as well. Does it hurt? I have tattoos, but not on my head. A lot of people say that it doesn't hurt. I guess it just depends on the pain threshold. If you've had a tattoo, this isn't gonna hurt. It's not gonna hurt as much. There's people that we've even had fall asleep to getting this done. But we've also had some people that they've needed to get some topical lidocaine. So it just depends. On average, it's kind of hard to pinpoint an average just because a lot of people have, it depends on the severity, how much coverage you need to determine the price. It's definitely a lot cheaper than hair transplants, that's for sure. It could be $6K. It just depends on how bad the hair loss is. And if they have scars, if they've had hair transplants and they have a lot of scarring on their scalp, that makes it more complicated, so that makes it a little bit more expensive. So I can definitely see $6K being the price. This is our channel. Like I said before, we do scalp micropigmentation here. If you are interested in scalp micropigmentation, we can do consultations. And if you have any questions, we can answer scalp micropigmentation related questions. Well, no, because let's see, a bunch of freckles. That's not how that works. I could see how you would think that. But you do get the benefits of microneedling. The main purpose of this is just to conceal. And for people that have severe hair loss or receding hairlines, this helps restore the hairline. So it just looks like somebody else earlier today said it's like a 5 p.m. shadow on your head. Can I do this at home with the same equipment? I do not recommend to do this by yourself or to do this at home or to get somebody else to do it. The amount of botched SMP works that we've had, the amount of blowouts that people come in with is scary. So I do not recommend for you to do this by yourself, DIY it, or get a friend to do it. No, no. Are you still working? Yes, we are. This is our second client of the day. It's dangerous. No. Yes, it does work. Does it actually work? It does. It does its job. Imagine someone just being like, get the tattoo gun. We've seen procedures that have been done like that. It's not good. Died from a botched beard implant from Turkey. Oh, beard implants. Yeah. I mean, it just like anything, right? If you're not going to someone with that's a reputable, that does the job correctly, then yeah, a lot of things could go wrong. What exactly is this? This is scalp micropigmentation. It's like a permanent makeup for the scalp. to help to create the illusion of density. This is not a hair implants. This is scalp micropigmentation. We are not implanting any hair. But yes, there's a lot of clinics in Turkey that are very, people need to do their research where to go for hair transplants for sure. We have also seen a lot of horror stories, botched hair transplants, really bad scars, and we help conceal that here. It doesn't hurt, depending on your pain threshold, I guess. Some people fall asleep during the process. Some people need some topical lidocaine, but it's on average not that painful. What voltage? 9, I think, is what he uses. A session usually takes about 3 to 4 hours on average. It looks like a massage. Well, it's a needle, so I don't know how much. What's wrong with it? Yeah. Yep, there's nothing wrong with it. Nothing wrong with being bald. Nothing wrong with anything. It's just preference, how you want to look, how you want to feel. Three to 4 hours without using your phone, no way. You can use your phone. We've had that. We've had people watch TV. We like to put their music on. They can do whatever they need to. We take breaks in between as well if they need to, so they can get their work done. This guy had a hair transplant. Yes, he did. He had an FUT, I believe. Later on today, he's gonna be working on the back of the head. You'll see the line scar. Is he asleep? I don't think so. How many appointments do they normally need? We like to do 3 appointments here. We give them the whole procedure. We don't do it per session. We also offer a fourth session if needed and a follow-up. We are not in Dubai. We are in North Carolina. It's not a derma roller. We're not a hospital. This is Scalp Micro Pro. We're located in Greensboro, North Carolina. Hello, hello. We are doing scalp micropigmentation. No degree. This is a cosmetic procedure. Yeah. And this is the first pass. This is his first session. So we gradually build the density so it looks more natural. Up close, you'll be able to see, by the end of his third session, you'll be able to see different layers of the SMP. So if it looks light and if it looks a little bit sparse right now, it's all intentional. We ask before we record. How much baseline is needed to qualify for hair transplant? Well, this isn't a hair transplant. I think there has to be. They have like this method of measuring the space to see if it's even possible for hair transplants. But this isn't a hair transplant. This is his first session. What's the difference between this and hair transplant? Hair transplants is actual implantation of hair follicles. It's to make it. That's the surgery to implant the hairs. This is scalp micropigmentation, which is like permanent cosmetics, is to simulate the hair follicles. This is cosmetic, purely. Does not make the hair grow. Don't know. Does it hurt? A lot of people say it doesn't hurt. We also have some people that fall asleep during it, but just depends. The cost ranges. It just depends on the severity of the hair loss. We recommend about a touch up every 3 to 5 years because it'll fade eventually. But it can go as far as 7 to 10 years to look nice. It's like permanent cosmetics, just kind of, I'm not sure if you guys have seen people with microblading or stuff like that. They have to do touch-ups to keep it fresh. Similar. Yes, similar to a tattoo. It doesn't go as deep into the skin as a tattoo, but it's around the same category. Do you do this on women? Yes. Women do get this done for alopecia. I don't know, maybe you can count the holes, all the dots that he makes. Thank you for taking the time to respond. Yeah. Any questions? We can definitely answer. It's not something that you see every day. Does your skin- Yeah, they do get tired after a while. It does look fine. No, hair strokes, doing hair strokes will actually make it look worse. If this is a close-up right here. No, it doesn't bleed. Like I mentioned, scalp micropigmentation goes on the upper layers of the skin, so it very rarely bleeds. The pigment that we use is what he uses the needle, dips the needle in. I see it coming together now. Yeah, this is just the first session. So in the first session, or in every session really, we go as light and as sparse as possible. And eventually it will, as we add on sessions, it'll start to blend in a little bit better. Hair pigmentation, yes. It helps create more density. I mean, the main purpose of scalp micropigmentation is to help with people that have thinning patches, receding hairlines. If they have scars from hair transplants, we help conceal those. Just helps make the hair look a little bit fuller. Receding hairlines, we help create those hairlines so they look nice. That's the reason for it. What do you charge? So the price depends on the level of hair loss, the area that they're working on, and how many sessions that are needed. We do consultations to be able to figure out the price. Since it's very customized, there's not one flat number. Some people do get a hair transplant afterwards. Some people, but the majority of our clients, though, they have gotten hair transplants and they didn't take or they didn't work. So instead of getting another hair transplant, if they're not candidates or whatever it may be, they just use SMP to cover the remaining areas. There are cartridges that have more than
¿Le duele el procedimiento?
No,
a set
todo
of
está bien,
needles,
no,
but it just won't.
no está bien.
I don't think it would work for it to create the follicles as natural as possible. how long is the process? So overall, scalp micropigmentation takes about 3 to 4 sessions, and each session lasts around 3 to 4 hours. And the each session is about a week to 2 weeks in between of wait time to heal. That looks really painful. Kinda. It's just tiny needles. It's like micro needling. Some people fall asleep at the chair, so it might not be that bad. Is he unconscious? He's not unconscious. He's awake. He's actually about to watch some TV, I think. I don't see a blister on his head. Oh, you guys are just being funny. Is the price the same for one session? I'm not sure the question, but we price based on the full treatment, what it would take for the full thing to be done. So if it's going to be one session, then yes, it's priced accordingly for one session. I don't know if that helped with that question. No, mid-session, like just get up and leave. We've never had that. Es un tatuaje, es micropigmentación capilar. Es un tatuaje cosmético. Hi, we're doing scalp micropigmentation. This is first session scalp micropigmentation on a client who's had a hair transplant before. And is now using SMP to conceal areas of the scalp. Yes, he has had a hair transplant before. I believe he had an FUT, so he has a strip in the back, a scar, in the back of his head. sometimes hair transplants don't take. Hello, hello. Welcome to the people that have just joined. We are Scalp Micro Pro Clinic. We do scalp micropigmentation, and we also offer other hair loss solutions. Right now, we are working on a first session of scalp micropigmentation on a client who has had hair transplants before. If you're new here, we like to join in on live to show you guys the process of scalp micropigmentation. We can answer any questions you'd like. You can subscribe, like this video, and hopefully this will help. Any questions you may have about scalp micropigmentation, we'd be more than glad to answer them. If you would like something more specific, pricing wise, or if it's the best option for you, we can also do consultations.
Vamos a cambiar de posición.
Ahí mismo me quedo.
Sí, pero vamos a hacerlo boca abajo.
Ok.
¿Puede levantarse?
¿No?
¿Se puede levantar?
Ahora boca abajo.
Sí, espera, dame un segundo.
Hay mucha nieve todavía. ¿No?
Demasiada nieve.
Esa va a costar que se seque esa nieve. Que se evapore. Ya va.
Ahora sí.
And I'm not sure if the people beforehand that were talking about the hair transplants, if they're still here, but if you can see that line that he has in the back, that's the FUT that they did. Hello, hello. If you're just tuning in, this is Scalp Micropigmentation. First session, Scalp Micropigmentation. Greetings from Germany. We are here in Greensboro, North Carolina. Brings out more color, more density. Yeah. When he starts working on that scar, by the end of the third session, which probably, it won't be today, this is the first session, but by the end of the third session, that scar that you see right there is going to be blended in. You won't even notice it. Yeah, it is. That's called a FUT, hair transplant. That's where they take basically a big strip from your hair and use that to implant on the front. FUE is much better because it won't leave you with that big scar. Hello, hello. This is Scalp Micropigmentation. We are helping him create density in those areas that look very thin and sparse. Right now, this is the first session. So it's, he's doing one pass. Eventually, we'll be adding some more density to make it look like it's actual hair follicles. If it looks a little bit light, that's extremely intentional. Minoxidil can work, but then you would have to take it forever. And then once you stop taking it, your hair you lose your hair again. You don't shave. A lot of our clients do end up shaving. A lot of clients have enough hair where they can still keep it and have SMP. We recommend if they have a receding hairline to shave their hair, and we help them make a nice little hairline for them. Will the space be there if the hairs grow long? Yes, this is permanent makeup. It's cosmetic. It doesn't grow hair. So if hair grows long, you will see the spaces. They'll have to keep it short or shave it. What are you doing that for? Well, he has a lot of balding areas and he wants to make sure his scalp looks a little bit fuller. That's why he's doing it. Think of it as permanent cosmetics. Are you a doctor? No. This is permanent cosmetics. If he loses more hair, he can always come back and get more, get SMP done on those areas, and we can help it blend in so it doesn't look patchy. But that rarely happens. Hair loss at one point starts to slow down. It doesn't just keep falling for some people. How much is it? It really depends. SMP is extremely customized. We're talking about the levels of hair loss, the density work that needs to be done, if there's any scarring. It's all priced differently. We do consultations here at the office, free of cost. Free consultations for anyone who wants to come in and get their scalp evaluated to see how much it would cost. Well, we do have a lot of people that are bald that come into our office to get this done, especially with people that have receding hairlines. Getting a hairline made, scalp micropigmented on, can makes them look a lot younger, a lot better. Can you get the ink off? Eventually it does fade away. The ink, we work in the upper layers of the dermis, so it does fade, but it doesn't come off. The only way to take it off is through laser removal. Does it hurt? Depends on your level of pain tolerance. We've had clients fall asleep on the chair, and we've had some that needed some topical pain reliever. Or numbing, sorry. Topical numbing. Are you a boy because you had a beard? I'm not a boy. The person that's working on the scalp is Victor. He's a boy. We are located in Greensboro, North Carolina. Yeah, no worries. If you are interested in learning more about the procedure to get it done for yourself, we do offer free consultations to our office. I think we have the website here on our description, and you can click on the link to schedule one if you're in the area. How much time does it take? So one session takes about 3 to 4 hours. How hard is it to learn how to do this? Yes, it's a permanent cosmetic. It's like a tattoo, but we work on the upper layer of the dermis and not as deep into the skin as a tattoo would. But it's a similar process. To learn is not that hard. We do actually have a training that we offer. It's a 3-day training. We are Scalp Micropro Clinic. Any side effects? No side effects. Very minimal, if any. Redness maybe, but that's like the worst that we've seen. Do you numb the area? Sometimes, depending on the client. If they have a low threshold of pain, if they can't really tolerate it, then we do put topical numbing. Most of these, the cartridges are single use. Everything that we use is single use, and we we are located in Greensboro, North Carolina. So we clean the scalp with the cleanser, and then everything else is single use, so everything gets thrown away. The machines get cleaned with antiseptic and disinfectants. Does it hurt? For some people it does hurt, but the majority of the people say that it does not hurt. We do have a website. You can go to scalpmicroproclinic.com. If you go to booking.scalpmicroproclinic.com, you can schedule a free consultation to our office if you're in Winston-Salem. We'd love to see you. We can definitely try to see how we can help you. Is the machine the same as the normal tattoos? No. This machine is, we should probably do a Q&A with Victor one day, but the tattoo machines are a little bit stronger because they work in the lower layers of the dermis, so they have to have a little bit more pressure. Do you do it for women suffering from pattern hair loss? Yes, we do. We do work with women with pattern hair loss too. We also have worked with a lot of women that have had traction alopecia. How long until it goes away? It typically lasts anywhere from 5 to 10 years before you stop seeing it, but we recommend getting touch-ups every 3 to 5 years to keep it looking fresh. Yeah, minoxidil is good. I know quite a few people that done it with tattoo guns. I mean, I guess I don't recommend, but I mean, we using a tattoo gun, using you could have blowouts, you can have it the inks bleed. You guys enjoy your week later. The website should be in our description, but I'll put it in the chat. 1 second. Yeah, it does. We've it does look good. And if they've had receding hairlines and then they get their hairline restored with SMP, it makes them look a lot younger. All right, for those tuning in, this is scalp micropigmentation. This is first session scalp micropigmentation. Yes, about to give the illusion of the hair. So this procedure is basically for people that have had that have hair loss. They're not candidates for hair transplants, or if they've gotten the hair transplants done and it just didn't take. Scarring alopecia, alopecia universalis, any of these hair loss conditions. SMP just kind of gives them the coverage and the look that they want. We work with men and women, women who've had traction alopecia or female pattern baldness. And they can get the coverage done too. He's going in the areas where he sees the most space, pretty much. He's not poking at the follicles, just covering up the balding. Yeah, we're helping everything blend in. No insurance, since this is cosmetic.
Hello, good afternoon.